You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello and welcome to another episode of the RN Mentor podcast. My name is Ali Tayeb and I am your host. Today I would like to introduce everyone to Dr. Perez, Dr. Adriana Perez. She is an assistant professor and senior fellow at the Leonard Davis Institute of Health Economics at the University of Pennsylvania School of Nursing. As a scientist, her research is focused on the influence of community-level factors on the well-being of Spanish-speaking older Latinos with Alzheimer's disease. And Dr. Perez has served as a policy chair of the National Association of Hispanic Nurses and elected congressional fellow supported by the Atlantic Philanthropies and Centers of Disease Control and Prevention Healthy Aging Program. She is fellow of the Gerontological Society of America and the American Academy of Nursing, where she currently serves as the Academy's Institute for Nursing Leadership. As a board-certified adult nurse practitioner, she provides community-based long-term care for diverse, frail, older elders who reside in North Philadelphia. Dr. Perez has received numerous awards and recognitions for her sustained contributions to research, education, and policy and practice. Dr. Perez is originally from Yuma, Arizona, a predominantly migrant Latino farm working community at the U.S.-Mexico border. She received her bachelor's, master's, and PhD from Arizona State University, College of Nursing and Health Innovations, where she also completed her postdoctoral fellowship. Welcome to the show, Dr. Perez.
Thank you so much for having me, Dr. Tayeb. Ali, thank you for having me.
Thank you for being here, and thank you for your time. I want to, before we get started anything, let's talk about Yuma. I've actually have been there a few times, and I was there for a couple of months, and it is extremely, extremely hot.
Yeah, so, it is very hot. Yes, it gets up to about 120 degrees this time of year.
I can vouch for that. I was during my time in the military, I was stationed at Camp Pendleton, and I was with the light armored vehicles, or LAVs, and we actually drove to Yuma to test new engines at the Army proving grounds that are out there. And when we got there, when we were out in the field, we would take ice water, and as soon as we were out the door, that ice water would turn into hot water. So, it is a hot place.
Yeah, and I loved growing up there. You know, I met my husband when I was in junior high, and we both went to Yuma High School. But as you said, you know, it's a border community, the southwest part of Arizona, overlooking the Colorado River. And an interesting part of Yuma is that it had one of the oldest territorial prisons, Yuma Territorial Prison. And the reason why I like to share that is because my high school was actually situated within the territorial prison. And so growing up, I wasn't a student at the time, but our mascot was the Yuma High School Criminals because of that. And it was a very famous mascot. Of course, if you're not from there, don't know the history, it sounds a little strange, but it, received many national accolades for being so unique. And so we had a very fun time growing up in high school, with the whole sort of, territorial prison background, and just had a lot of fun with it. So I like to share that as a bit of a, fun fact. But let me add, the other thing I love to share about my hometown is that it was home to Cesar Chavez.
Oh, wow.
Cesar Chavez, was from Yuma, Arizona, and he actually grew up in a, a smaller town closer to the border, Gadsden and San Luis, Arizona, and he spent a lot of time sort of in Gadsden, San Luis, Arizona, Somerton, and so it's he is part of the history of Yuma, and I always like to share that I'm from where Cesar Chavez was from.
Wow, that's amazing. That's amazing. Thank you for sharing that.
Hmm.
So I always like to start with my guests talking about how they got started with the profession of nursing.
Hmm.
How did that come about, and what was your experience like coming into the profession?
Well, I love talking about this, so thank you, thank you for the question. I so my grandmother was a nurse in Mexico, and my brother and my sisters and I would go and visit her, and the rest of our family in Mexico every summer. And we did that every summer throughout my time in high school. And so I always, as a young girl, would see her in her nurse uniform. And what I admired about her was that everyone in the neighborhood, loved her, respected her, and would go to her for advice when they were sick. In Mexico, one of the differences in terms of the system there is that pharmacists are ones who provide a lot of education for medication. They can administer, let's say, injections, et cetera. And so she was very close with the pharmacists around the corner. They would call on her for questions as well. And oftentimes she served as a private duty nurse, and so she would take me along with her, and I just loved seeing her in her role. And so forward years later, I was in a senior in high school, and our English teacher had us write a paper about what we were going to do, what profession we would pursue upon graduation. And um, you know, uh, I had a summer job at the time, and I was sharing with someone who served as a mentor to me at the time when I was in high school that, I really loved what my grandmother did as a nurse. And he said, he was my supervisor. He said, my wife is a nurse, my daughter's a nurse, and I think you would be a great nurse. And I think you should, go into nursing school. And so I did. I mean, I basically used that assignment to do my research on nursing, look at what the environment was like, the demand, what kind of different roles nurses had. And I got very excited. So that's what I wrote about. I did well on my paper, and my teacher encouraged me to pursue nursing. And luckily, in my hometown, we still do have a associate degree program, Arizona Western College, and that's where I went first for a 2-year degree program, and I really, really loved it. So that's how I got started in nursing.
That's fantastic. Now, how did you, since you started as in an associate's degree program, what convinced you? Obviously, you've come a long way since your associate's degree program. What convinced you to um, move further ahead in your career and your professional path?
Well, our the faculty in our associate degree program always always talked to us as if we would continue. It was they um, they always talked about sort of our next step, and so it was ingrained into, definitely for me, it was ingrained in my thinking that I would continue to go to school. And it was always my dream to go to Arizona State University because I was from a small town, and I had older friends who were going to ASU. And back then, and even now, it had this image of being a party school. So I always, wanted to get away from the small town and just sort of venture out. But what I took away from it, the image of it being kind of this fun school, was that I can have fun while studying, and I could have, sort of this balance of being in school in a very tough academic program, but at the same time that there was a lot of fun there. I would have fun being with my friends and not being too far from home. So I knew right away that I would move. And as soon as I graduated, I think within the next few days, I literally packed up, a van and went and moved to Tempe to start right away in the fall. I started my bachelor's program and just continued on. At the time, Arizona State had a bridge program that actually took nurses from their associate degree program, or if you had another degree, and so that you could continue on your master's. So that was helpful for me because I knew I would get my bachelor's degree, but I was on my way already to get a master's degree, and that was very motivating for me.
Oh, that's great. I know a lot of bridge programs have come along in the last few years, just from the as a result of the IOM report, the 2010 IOM report. They were kind of ahead of their game. Now I know you have had a lot of most of your work and research right now is around geriatrics. Can you talk
Mhm.
to me about how you got involved in that process and how did that come about?
Yeah, so my first position was in long-term care. I was a licensed practical nurse. That was another cool thing about our program is that after your first year, if you spent the summer, with some additional training, you can become an LPN. And I was very excited about that because I always went to school and worked. So being an LPN offered me another opportunity to be able to get hands-on experience. I mean, I was very young, and yet I could work, help my family out and be in school. And so that my first position was in long-term care. And I always loved long-term care. I loved being around older adults. And really that decision for me was solidified when I moved to ASU and I started working at St. Joseph's Hospital and Medical Center. I worked in a cardiac floor, and most of our patients were older. So, I always felt like no matter what, um, it's important to know about aging and healthy aging, especially because regardless of where you work, if it's the ER, if it's ICU, most of your patients are going to be older. So, I thought for me that was a no brainer. And I had also really studied our profession and where sort of the gaps were, the needs. I knew that Latinos were a major need in our profession, as well as nurses that specialize in gerontology. So for me was, again, something that motivated me to try to be one of those that would try to fill the gap.
Thank you. As far as your career path, I mean, it sounds like you definitely have a love for going into the field that you went into. What motivated you to go the doctoral route and actually do research in the area or in the field?
Yeah, so when I was a nurse in this cardiac unit, I think I always say that my research question started then in my master's program. I just became, very aware of the system and the fact that most of our patients who were Latino, especially being in Arizona, in Phoenix, that you know, I was very active in governance, and I was recruited to be part of our cardiac quality team. And I really loved learning about our system and where we needed to improve. And so one thing that was very obvious was that when it came to our quality measures, older Latinos, especially older Latina women, would not experience the same quality. They would not have the same quality cardiac outcomes as other patients. So I always ask, why was that? And it really encouraged me to go back to school because, I think as a nurse, you realize that most of what we learn to do is based on the majority population, So as I started reading more and more, I realized that most of what we did, was did not include older Latinas or Latinos or immigrants or people that didn't speak English. So I just felt that was a big need, and I knew that having a PhD would prepare me to be able to, you know, uh, increase our knowledge, develop knowledge, create tools for nurses to be able to provide um, care for patients like the ones I was seeing, that were, really not able to benefit from advances in science or whatever we were doing in the hospital. So, I've grown a lot since then, but really that's how my interest in research began. And luckily, um, you know, the PhD program at ASU started a year after I graduated as a nurse practitioner. So I thought, this is perfect. I'll work as a nurse practitioner for a year and go back to school, to get my PhD when the program starts. And I was in the first cohort of PhD students at Arizona State. And I feel very fortunate because I had, the best mentorship experience ever, as a doctoral student. And it really built from my graduate program. In my master's program, I wrote a thesis about the cultural meaning of heart health for older Latinas. And I met a young, researcher, Julie Fleury, at Arizona State University. She had, developed a theoretical framework that focused on individual wellness, but took into account the environment, social support network, and the individual's own values and motivation for health. So, I that's how I learned. And she not only, was she this brilliant researcher, but she was a great role model. And I loved going with her to the community where she was doing her research and seeing her really display the values and the integrity of a researcher. And I just wanted to be like that. And, I was able to continue to work with her in my PhD program. And so I think that really helped me along the way.
Thank you. How did you just the part of how everything kind of came together that you happened to have somebody at the university had that had developed an instrument um, uh, that helped you in your studies, and having a mentor like that must have been very meaningful. Now, this is something that comes up a lot with when I talk to some of my students, and maybe you can shed some light on this. How do you go about choosing either a university or a program or a mentor that actually aligns with what you want to do? What was that process for you?
Well, and then you're right. That's a very important question because a match doesn't always happen that way, as you pointed out. Like I said, I feel that I was very lucky that I had, I think, not just Dr. Fleury, as a match, but I had a team of mentors. And, the other mentor that I had, her name is Esther Ruiz, Dr. Esther Ruiz, and she was the co-founder of the National Association of Hispanic Nurses in Arizona, that chapter. And I had heard about Dr. Ruiz before I moved to Phoenix. I she was one of something like three nurses west of the Mississippi with a PhD that was a Latina. And so I knew that I would be very lucky to be in a university where she was, and she was there. And so she was a mentor that helped to fulfill, my needs culturally, right? Like she helped me stay culturally grounded, make sense of what I was learning, in terms of the Latino culture, older women, aging, etc. And so that, again, it was a perfect match. It's not always that case. And I say that because I was really encouraged to pursue my own research, to develop my own intervention that I could test in the community. And so I say it's not always the case because often students, to be honest, students will enter a program and what I see that they do is mainly do work for their mentor. Does that make sense? And it's not that it's wrong or, I'm not, I don't have a strong opinion against it. I just feel lucky that I was encouraged to pursue my own research question, that I could, be creative about what I wanted to study. And even though at the time it was considered very ambitious. I wrote a National Research Service Award to the National Institute of Nursing Research. It was funded in the first try, and it was, even though the reviewers said that it was very ambitious, they felt that I had all the tools, the resources in place because I had, been at ASU for my master's. I had written a thesis. I had, great mentors that had, great funding. So I don't, I wish that more students had that experience, and it's not always the case. Again, I see in many universities, you're encouraged to, the goal is for you to finish on time. And I finished in 4 years, and some, it's the goal is to maybe even finish in 3 years. So the only way that many can do that is by doing secondary analysis, sort of building on their mentor's program of research. And again, I don't think there's anything wrong with that, but I just feel very fortunate that I had a different experience.
I definitely agree with you. That's one of the things that actually I was looking for when I did my PhD program was a school that was going to allow me to follow my research path, not necessarily do a piece of somebody else's sort of portfolio. And that was just a personal choice. I was looking at a population that I knew nobody else was looking at. So it was going to be difficult to find, like a university that's going to allow me to kind of do my own and just support me during the process. And I was lucky enough, like I said, to have a few mentors that had I looked at veterans with less than honorable discharges, and I had a couple of my mentors ended up being actually veterans, and one of them was a career military person that's now teaching. So they were able to support me in the process and kind of give me some leeway. So that was, I know it's important for certain researchers to do what they kind of want to do, but they need the guidance. So I know it's important. And it is ambitious. I was told, don't do it. It's going to take you forever, but I got done in time. So it's just,
yes, it can be done. Yes.
it can be done. It can definitely be done. So thank you for sharing that. Now you have a rather robust, research work done with your population, and right now you're studying Alzheimer's disease and related dementias. How did you get involved with that process? Because a lot of times, and I know a couple of nurses that work with with something where you would think it would be more clinical, as far as something that nurses don't usually get into, but I know a lot of nurses that do clinical research. What is your research involved with, and how did you get involved with it?
Well, building on my original work in Arizona, as part of my pre-doctoral program and then my postdoctoral program, I developed and tested a physical activity intervention among older Latinas, to improve, not, to increase physical activity in order to improve blood pressure and other cardiovascular health outcomes. And it was, an intervention, 12-week intervention, community based, building social network, building community resources, and really focusing on individual participant motivation and goals. What I learned early on, and actually this is something that I've taken, with me to my practice now as a nurse practitioner. And that is, that every person has, even though, our culture, as far as Latinos, there are common threads, language, certain traditions, family, familismo, there's these values that are spoken of in the literature for decades. Every person, I've learned, has a different and unique motivation for their own health goals. So I always say that, none of my patients ever say, oh, my goal is to, have a total cholesterol less than 200. No one ever speaks that way. They each have their own goal of why they want to stay healthy, why they want to do X, Y, and Z. And in this case, it's physical activity. And I always ask that, I ask that of my patients, like, what do what do you want for yourself? What is your goal? And I love learning that about them, because then, I see myself as a facilitator in their goals. And I feel privileged enough as a provider to be able to come into their life and be able to, help achieve some of those goals. But it really is their goal. And so this intervention relies on a person developing their own goals, uh, being able to self-regulate throughout the program, so monitoring their own progress and being successful as a result. And because, they increase their social network support, they increase their community capacity to stay healthy by finding places to walk that are safe, etc. All these, there's multiple levels of strategies in this intervention. So, fast forward, my time now at the University of Pennsylvania, what is very striking to me is the the number of Latinos that are experiencing a disproportionate burden of cognitive health disease, namely Alzheimer's disease and related dementias. Many of the reason, there are many reasons, and one is really due in large part to high rates of physical inactivity. What I'm seeing is also that older Latinos, actually 50 and older, are hardly ever assessed, for their cognitive, they hardly ever receive a cognitive assessment. And that is really key, to being able to identify, to detect any kind of potential cognitive problems. So what I'm now interested in doing is replicating this work, but also seeing if physical activity not only improves cardiovascular health, but can also improve or delay cognitive decline and improve other things as well, like sleep, that we know are tied to overall cardiovascular health. And so it's, there's this proposal that I just submitted to the National Institute on Aging. Has been reviewed, waiting for funding. Hopefully, eventually, it's something I don't plan to give up on, because really, less than 1% of clinical trial participants include Latinos, and to me, that is, just it's just terrible when it comes to health and healthcare. Because again, going back to how I started as a nurse, as a young nurse, I knew that most of the guidelines, the protocols that we implemented, hardly any of them included Latinos, and especially those that are Spanish speaking. So I'm very determined to change that. And so I think, for that reason alone, this research is important. And secondly, this Alzheimer's is expected to increase by 800% among older Latinos in the next 20 years.
Wow, that's I was as you're talking about this, I've had a issue with the fact that especially when it comes to older adults, we have like when we teach medical surgical nursing or anything like that, we don't really address, even though we address older adults as sort of a footnote into the overall of what we teach in nursing school. But it's not really emphasized, I think, it as much as it should be. Same thing. I worked for an organization that became niche certified, and I was uh, uh, one of the individuals that actually was on the leadership team that actually helped implement that at the facility. And one of the things I had an issue back then with the program was it didn't really address cultural components, and it may have changed since this is many years ago, but it didn't address them. So when you're talking about like the like Latino, Latina, Latinx populations, that has a whole different component, because I always think back to my when I was in nursing school, I had a Latina patient who was probably in her, I want to say, early 60s, maybe mid 60s, and she had newly been diagnosed with diabetes, and she refused to make some lifestyle changes because of the family dynamics, and the husband was not willing to change lifestyle of the family, and it became quite complicated, and it was a little over my head at the time. But I remember, it's one of the stories I still use when I talk about, do we need to have a greater awareness of culture and environment. And so when you talk about specifically what the individual goals are, it kind of speaks to me from that perspective, because we can't just hand somebody a pamphlet and teach them the pamphlet and they're good to go. So that individualization really becomes important for the patients.
Exactly.
That's okay. Well, thank you for sharing that. Now, as far as I want to talk to you a little bit about the Latino Latina population in healthcare. Just because I teach at a university where we have a large Latinx population in our program, and at the university, I think that that's actually the majority of the university is being in Los Angeles. That's being in the heart of Los Angeles. That's the population that we serve. What do we need to do to increase the population, and what do we need to do to get more of the population into our advanced practice nursing and teaching and going into research? Because I think, we talk about diversity, and I think it's important that the people that are researching are also of a diverse background, because it just brings a whole different perspective to the science. So what do we need to do? What do you think we need to do?
Well, I'm really glad that we're talking about this subject, because it is also another sort of arm of the work that I do, because I recognize, being a researcher and a nurse practitioner, that there are not very many of us. And so you're spot on that our worldview, our perspective, does impact our science. We ask different questions, we interpret findings a certain way. Obviously, speaking the language is a big plus, because you don't have to have an interpreter for these things. You have a direct relationship with a participant or a patient, and that makes a world of difference. And so I think that, when I graduated, or, when I was starting nursing school at the time, my academic advisor said that less than 5% of nurses were Latina, Hispanic. And I could not believe it. I was really struck by that. And sad to say, here we are 20 years later, now that I'm a nurse, that really hasn't changed. We have not kept up with the growth of the population. And it really is, I think, at a detriment to our population, because not just among Latinos, but, African American, Asian Americans, I feel like our profession, which is, supposed to be the most trusted profession, doesn't fit the communities that we serve. And so what is it that, over these last 20 years we have done and not done? Well, I've looked at the literature, and obviously, number one is an investment in the infrastructure that it takes to recruit, retain, and mentor and ensure the success of, in this case, Latinos, Latinas. Um, Oftentimes, these are efforts that are left to a few to try to solve, but it really needs the support, top-down support, from, and if we're talking about academia, from the very top to the very bottom, we need the support and the understanding that that is a goal of the institution. It cannot always just be left to a few, that are faculty that are Spanish speaking. I really do think it takes a concerted and organized effort to be able to do that, number one. And again, number two is really that infrastructure is supported financially in order to be able to sustain efforts. Recruiting, retaining, mentoring students uh, uh, requires support. It requires resources and dedication to that kind of time. And I know, because when I was a student, speaking of Doctora Ruiz, I always went to her for everything. And I know that she was there for me because she cared about me, but those weren't things that were on her CV. Those weren't things that she got promoted for. Those were things that were not acknowledged. And I feel like this sort of cycle keeps repeating itself. We need to acknowledge the time and contributions of Latinx faculty and other faculty that are working really hard to make sure that our profession changes for the better of our community. And so these are efforts that I think really need support, and at all levels. So those are things that I know through the literature continue to be barriers. And as you've pointed out, I think there is a growing community, especially of Latinos in LA. I see it now that I moved to Philadelphia. I think that we should start thinking out of the box in terms of who our partners are. I say this a lot when I talk about this topic, and that is, there are other institutions outside of healthcare that do this very well. In other words, recruit and retain Latinos, find, ways to engage and positively engage Latinos into different fields like education, for example. There is a great organization in Phoenix called Chicanos por la Causa, and they recognize that health and healthcare are, factors that contribute to early education. So, they're invested in education and invested in healthcare. They see how all of these things are connected. And yet I see, very little effort in terms of nursing or other healthcare organizations that reach out to organizations like Chicanos por la Causa to partner, to learn, best practices from such organizations. And I think we could do a better job at working outside of our comfort zone to really learn from the experts in these areas.
Yeah, I've been fortunate enough to work at a university that has the population, and we have a department, and we're actually there's a new college being developed at the university around ethnic studies. So I know there's support at the universities. We just I have I have colleagues that work at schools that don't have the same resources and don't have the same perhaps support. And I think part of what you're saying is correct. It's sort of the structure and the leadership don't may not have the know-how into how to do exactly what you mentioned, which is recruit, retain, mentor. Those components may be missing. Because I do the same thing at my university with well, I'm a veteran, so I reach out to the veterans that come into the program, just so there's a instant sort of trust that is built.
Exactly.
So I think that makes a huge difference.
Exactly.
But you're right; those are things that we don't necessarily get credit for. But they're necessities that we have to do in order to make sure our students are successful in the program. So I think it's a extremely valuable thing when you have a diverse, culturally diverse, background-wise diverse. When you build a program. So I completely agree with you.
Well, and now being, on the other side, just as you're doing, I mean, there is so much satisfaction that, you receive as a mentor now, or as someone who, is now so invested in ensuring that, these numbers change, because then you see what our future will look like, in young students, or, in your case, young veterans that are entering, the university, the institution, and you do get so much out of it, as a mentor. And I do love that part of my work, but it is above and beyond what my role is. And I just wish that for me and others that do this day in, day out, that there was somehow that support, that acknowledgement and that support, to just as much as our research is important. I mean, think about, we're changing the face of our profession, and in my case, the scientific workforce, which continues to lag behind. So I think this is equally important as a contribution.
Absolutely. And actually, I brought this. I had the opportunity to speak to Dr. Grantive a while back for one of the podcasts, the president of ANA, and something we brought up is making sure that we engage in the communities that we're not necessarily of the cultural background. I am not of a Latino or Hispanic background, but I joined the LA chapter of the Hispanic Nurses Association, and primarily, like I said, it was because of making sure that I'm aware of the community that I am in. Los Angeles has a large Hispanic population. So for me to be involved in a chapter like that was important. Just also, I have, I teach at a university that has the same population. So it's important for me to understand the population more than just what I read or, a few friends that I have.
Right.
It's more complicated than that. And having those resources that I can, if I don't have the answer to, having the ability to guide my students to another nurse that they may feel more comfortable speaking to or use as a resource.
I did the same thing, Ali. I joined the Southeast chapter of the National Black Nurses Association in Philadelphia, because predominantly where I live, and West Philly is predominantly African American community. And I wish I would have done it earlier, but I joined for exactly those reasons, to understand my community better. I have students as well, like you said, that are part of the community. And so it is important to be grounded where we are and to know what are the issues, as well as the traditions, sort of the resources that exist within this community. And I've just been so impressed with the chapter and the president and what they offer. So I do recommend it. And so you're right. I mean, you were right to do that. And I encourage our colleagues to do the same.
Yeah, it's definitely been COVID-19 sort of has thrown things off. We were actually supposed to have a conference after after everything kind of got shut down, so weren't able to do that. But hopefully, when everybody's back, we'll be able to get back on the horse, so to say, and continue that work. So I know the LA chapter is very active, and so I look forward to continuing to work with them.
Great.
So thank you so much. Anything else you want to share with our listeners?
Well, I think, it was important to cover mentorship. We talked about, who my mentors have been, and then the fact that, I now have, I feel very, I love the mentoring role as well, now that I'm a faculty member. And, what I tell my students and my mentees is that, encourage them to look for many different mentors. It could be, as I've shared, my research mentor, my sort of personal mentor, Doctora Ruiz, in terms of my culture and being confident in my own knowledge. In terms of your leadership track, find mentors there. And I've been very fortunate to have excellent mentors. And when it comes to leadership, people like nurses like Linda Burns Bolton, Taylor Hardin, and others. And even, those that you might admire from afar and you only get to talk to them at a conference, but you stay connected through email. There are many ways to, I think, to stay connected with people that you admire, whose career you admire. And there are things about that person's accomplishments or contributions that you see, yourself being able to do. I think that's very important for all of us, no matter what stage of our career we're in. So I did want to share that I continued to do that myself, and but in no way am I an expert. But I feel like having a good mentor and mentoring others is definitely key to making sure that not only our profession grows and reflects our community, but that we really do solve these sort of bigger, more complex issues when it comes to health equity, and ensuring that everybody has an opportunity to be healthy.
Great. Thank you so much. Well, thank you for your time. I greatly appreciate you being on the podcast. I look forward to following your career. I know we're connected on Twitter, so I will continue to follow and see what you're doing, and hopefully we'll have you back on the show.
Absolutely, and thank you so much for doing this. Congratulations on your show and on your artwork. I look forward to seeing that as well and staying connected to you. Thank you.
Thank you so much. Have a great one.
You too.
You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources, and don't forget to subscribe. Until next time, I wish you fair winds and following seas.